Hello guys, I'm Dr. Fatma Al-Khamisi. I will be with you to teach you diseases of the locomotor system. In other words, the pathology of the locomotor system. Um, and first of all, I'd like to discuss with you what are the main components of the locomotor system. First one is the muscle, second is the bone, third, the joints, and fourth is the soft tissue. It's a mesenchymal tissue that supports muscle, bone, and joints, like fatty tissue, like vascular tissue, like neuronal tissue, nervous tissue, right? Like fibrous tissue, and so on. So, as we are in pathology studying diseases, the diseases of the body systems are mainly based on your understanding of the diseases in the general modules, okay? The basic medical sciences module. However, you can start from this module if you wish, but let us try to relate the diseases of the locomotor system to the basics of diseases that you already studied in the first and second modules. So in the first module, you studied adaptation, right? In which cells try to survive external changes in the environment. For example, in starvation with no enough food entry to the body, muscle cells may undergo atrophy and decrease in size to adapt or to survive the decreased nutrition status, right? Cell injury. Cell injury is like when you get, for example, infection in bone or in joints, right? Bacterial, for example, bacterial infection that destructs the cells and causes its necrosis. Necrosis is a form of cell injury, okay? So the main topics in the general pathology are all applied on every human body system, and this includes the locomotor system, right? You also studied inflammation, and in inflammation the body reacts to a certain irritant that injures the cells, right? And also muscle, bone, joints, and soft tissue can get inflamed. In the second module, you learned healing, right, and repair, and this is also will be applied on the locomotor system. For example, when someone gets a bone fracture, we need the two ends of the fractured bone to unite together and heal into one bone, right? This is a form of healing. Circulatory disturbances. In circulatory disturbances, you studied the changes that occur in the circulation and affect the blood supply of the organs, right? For example, the thrombosis. When a thrombus occurs, it may obstruct the arterial supply of the organ, which may result in infarction, right? We can get a thrombus inside the locomotor system, yeah, in one of the arterial supply of the organs, maybe an arterial supply to a certain bone, and in this case we will get a bone infarct, right? We also studied the embolism, and the embolism was a circulating solid substance in the blood, and the embolism also causes obstruction of vessels. And you studied a certain type of embolism, which is fat embolism, in which a bone fracture may lead to entrance of the fatty bone marrow inside the circulation, and this fat will circulate in the blood and obstruct another vessel in another organ, mainly the lung, and causes fat embolism. So my point is what? My point is, if you attended the previous two modules in our faculty, you will have some basic knowledge about the general scheme of diseases, okay, the general description of disease categories, okay, and you can apply this information on the locomotor system and other body systems in the future. But if you didn't attend the previous 2 modules, no problem. You will understand everything in this module. So let's complete our picture of the modules and get to the 3rd module, which is the locomotor system module that we are in. In the locomotor system module, we will study disease categories in muscle, bone, joint, soft tissue that may be classified under adaptation, cell injury, inflammation, healing, circulatory disturbances, yeah, as we said before. And also there are 2 additional categories that can be included in the general schemes of diseases, but we will study them in details here in the locomotor system, okay? But these diseases, these categories can be applied on any body system. These 2 categories are neoplasms. Neoplasms are tumors, okay? And metabolic disorders. And by metabolic disorders, we mean changes in hormones, metabolic function, ions, and so on. Okay, so we will study in the locomotor system the disorders of the muscle, bone, joints, and soft tissue. Okay, but at first, to understand the specific category of bone tumors or bone neoplasms, we need to discuss in some details the neoplasms or the neoplasia. Okay, so my objectives from this lecture that you will be able to classify the categories of locomotor system diseases and to define some terms related to the neoplasia and classify neoplasms or tumors and differentiate tumors from a type of adaptation called hyperplasia, and to know or outline the complications and causes of death of neoplasms and recognize how do we name the tumors. So let's start this lecture with basics of neoplasia. Do you see these pictures? All these pictures are types of neoplasms. They are tumors, but they have different shapes, right? Some of these tumors are called benign tumors, okay, and some are called malignant. But how can we differentiate the 2 types? This is the one thing of what we will know in this lecture. So at first, we need to set some definitions. We need to form a common background, okay, with some terms. The first one is called neoplasia. Neo in Latin means new in English. Plasia means growth. So neoplasia means new growth. New growth of what? New growth of cells. This is abnormal cell proliferation that can form a mass. Okay? This is a tumor. Neoplasia means tumor, actually. Okay? But this form of cell proliferation is autonomous. Autonomous means spontaneous, means without a cause and without control. We cannot stop this cell proliferation because the body has no control on this cell proliferation. And in the same time, this cell proliferation is aimless. It has no useful function, okay? So this is neoplasia or neoplasms. So in neoplasms, cells proliferate. The proliferation is uncontrolled and autonomous, okay? The cells that proliferate and form the mass may resemble the original tissue or the original cell from which it arises. This resemblance may be close to the original cell, okay? So the tumor cells are close in shape to the original cells from which they arise, or they may differ in shape because they have remote resemblance. Remote means away. So they don't resemble the tissue of origin. Okay? The growth of the tumor cells occurs at expense of the surrounding normal tissue. What does this statement mean? It means that usually in the tissue, no space for abnormal proliferations. Cells are close to each other. But when the cells get mad and proliferate without control, they need space to grow in, right? This space comes from where? This space comes from compressing or invading the surrounding cells. So which proliferation will cause compression of the surrounding cells and which one will cause invasion? That is what we will know later on in this lecture. Another thing, all neoplasms arises from one cell. What do I mean? That a single cell at first gets mad and gets uncontrolled proliferation criteria. This cell is the original cell of the tumor. The cell continues to divide and gets a bigger tumor and bigger and higher number of cells and so on. So the daughter cells are daughter to one cell, right? A parent cell. So they have a similar clone, a similar DNA chromatin like the original cell, right? So they call neoplasms are monoclonal. Monoclonal means have one. Mono means one, means single. Okay, clone is the offspring. Okay, so they have all the offspring has one single shape. Okay, that is derived from the original one cell. Another term is oncology. Ology means science. Onco means tumor or neoplasm. So oncology is the science that studies neoplasms, including the treatment. So what is cancer? Cancer is a neoplasm also, but the malignant one, the bad neoplasm with bad behavior and bad prognosis and fatal behavior. This is called cancer. Okay? So now we know definitions of neoplasia, oncology, tumor, and cancer. So we want to just imagine what is meant by monoclonal cell proliferation. So let's watch this video and share a new screen for the video. Okay, let's see what happens. These are normal cells. In normal growth, one cell dies, and on death of this cell, because it ages, for example, on death, the nearby cells divide to replace the dead cell, right? This growth is controlled. The nearby cell just replace the dead cell, right? The nearby cells do not divide haphazardly with a large number of cells, right? Just the same number as the lost or dead cells. This is a normal graph. But look here, if something happens to the DNA content, the chromosomal content of the cells, like here, there is a mutation, a change in the genetic structure of one cell. This change will affect the proliferation criteria of the cell. This means as a cell with the mutated cell is abnormal cell that don't have criteria that stops its proliferation. So let's see here what happens. The original cell will give daughter cells, right? And daughter cells will give daughter cells and granddaughter cells, and right? What happens here? It is an abnormal, uncontrolled cell proliferation, right? This is called a tumor. All these cells originated originally from one single cell. So they are called monoclonal, okay? So the purple cells are the normal ones, and the yellow cells are the tumorous ones, or in other words, the neoplastic ones, okay? So let's stop here and we will get back to the rest of the video later. So let's share the screen again for the presentation. So I hope you now know or imagine what is meant by neoplasia or a tumor. So when a single cell proliferates, it has some possibilities. One of the possibilities is that it just divides by mitosis into two cells, a controlled division. And the cells are very similar to the original one. This is called normal growth with mitosis, right? Another possibility is that the cell gives higher number of daughter cells that are similar to some extent to the original cell. And this is a tumor, right? We just described something like that. But there is another option. Another option is called hyperplasia. Hyper means increased. Plasia means growth. Increased growth. By hyperplasia, we mean increased number of cells. So we have two disease categories or two pathologies in which cells increase in number but maintain similarity, some similarity to the original cell. One is called tumor and the other is called hyperplasia. So what is the difference between the two? Hyperplasia, if you attended the first module in the year, is a form of adaptation. What's meant by adaptation? The cell tries to survive some external changed factors in the environment. So hyperplasia is a growth of cells that has a certain useful function, right? However, neoplasia has no useful function, right? Hyperplasia is dependent on the cause or on the changed environmental factors. So if the hyperplastic cells just reach a level that can maintain its function in this changed environment, they stop growth. That's why we call hyperplasia a limited growth. And by the way, if the changed environment that caused the hyperplasia reverted back to normal, hyperplasia will revert also to normal. This is some form of controlled cell growth. However, neoplasia is unlimited growth. Cells just continue to divide without a dead end, okay? In hyperplasia, cells are normal in shape and pattern. The cells are similar to the original ones. However, in neoplasia, cells may have some abnormality compared to the original cell, cells, right? Hyperplasia is diffuse in the affected tissue. It is not limited to certain part, right? Why? Because all the tissue was exposed to the changed environment, and all the tissue need to alter its function or modify itself to survive the changed environment. However, in neoplasia, one cell gives a mass of cells, right? So sometimes the neoplasm or tumors may be capsulated. What's meant by capsulated? Surrounded by a fence formed of fibrous tissue or collagen fibers, okay? So neoplasia may be capsulated. However, hyperplasia is not. Okay, so these are the main elements that differentiate hyperplasia from neoplasia. So let's now continue setting some definitions in the neoplasia, and let's come to the term invasion. What's meant by invasion? Invasion means occupation. It means that cells destruct the nearby cells and replace them. In other words, it is a form of spread of tumors or neoplasms to adjacent structures. And not all tumors can do invasion. Some tumors with certain criteria, okay? Another term, metastasis. What is meant by metastasis? Metastasis is when a tumor or a neoplasm sends some of its cells away into another organ or another non-nearby site, okay? And these cells go to that distant site and implant themselves in that site, and continue uncontrolled proliferation and form daughter tumors in the other organ. So metastasis is the distant spread of the tumor. Invasion is the nearby spread of the tumor. Okay, either invasion or metastasis can form in or can happen in some forms of tumors, which are bad aggressive tumors, and not in all tumors. Okay, the bad aggressive tumors are called malignant tumors or cancer. So let's now watch this video to get a more close picture of invasion and metastasis. So let's share the video. Let's see this video to understand the metastasis and the invasion more. Look here, this is the initial tumor, right? There is a rapid rate of growth, and then the tumor sends one cell or some cells to a distant site, and these cells implant in the new site and go on with the uncontrolled proliferation, right? Here is another metastasis because the cells get to a distant site. This is called metastasis. When cells grow in the nearby site, as these cells invade the surrounding tissues, this is called invasion. On the local site, it is called invasion. But in a distant site, it is called metastasis. Okay, so local invasion, it is the direct invasion, the direct growth of the tumor into the tissue, okay, into the closed tissue, the tissue next to the malignant cells, okay, of the first lesion, of the primary tumor. While this is called invasion, while metastasis is the distant spread away from the tissue that is close to the primary tumor. So this is metastasis. This is metastasis. Another fourth metastasis. Okay? This is the cause of death in cancers, in malignant cells, because all the organs gets distracted by the new lesions that spread to it. Okay, let's see. This video was the original one. Let's continue it after forming the tumor. Okay, look here. The tumor grows, okay, and it sends the yellow malignant cells, okay, in the blood, maybe or in a lymphatic vessel, in a lymph vessel, to the malignant cell implanted in another tissue and formed another tumor, right? So till now, we knew what is meant by neoplasm or tumor, what is meant by invasion, what is meant by metastasis, what is the difference between a tumor and hyperplasia, right? Let's continue. There is a term called differentiation of cells. What is meant by differentiation? It is the degree, okay, or the extent to which the tumor cell resembles the original cell. Okay, so the cells of the tumor can resemble the original tumor, as we said before, to a great extent. In this case, this is called well differentiated, and it is a good tumor which is well differentiated and has a better prognosis, okay, or a better outcome. This is meant by prognosis, outcome. However, some tumors have lesser, their cells have lesser resemblance to the original cells from which they arise. So they can be described as moderately differentiated or with less resemblance, poorly differentiated. With no resemblance, it is called undifferentiated. And the greater the shape, the cells are away from the normal shape, the greater the undifferentiation, right? Great. The worse the prognosis or the worse the outcome. Okay? So well differentiated tumors are resembles the original cells to a great extent. The rest of the grades of differentiation, okay, are less similar to the original cells. Okay. And by the way, although well-differentiated tumors have better prognosis, the undifferentiated and poorly differentiated tumors, okay, that have no similarity to the original tumor or the original cells, have a character. They are aggressive, right? And have bad prognosis. They are very rapidly proliferating compared to the well-differentiated ones. However, they respond better to treatment by chemotherapy and by radiotherapy, because chemotherapy and radiotherapy affect the rapidly proliferating cells. Okay, so there is a good point in the bad situation of the less differentiation. So let's see here. Let's see the possibilities of differentiation. This cell, the original cell, gave two similar cells. This is mitosis, this is normal growth. I'm sorry. However, when this cell gives a tumor, right? But the tumor is very similar to the original cell, this is called differentiated. And if the cell gives rise to a tumor, but the cells have little or no resemblance to the original cell, this is called poorly differentiated or undifferentiated. Here, there are some similarity to this tumor because the cell is oval, right? This is a somewhat similar cell to the original one. This is somewhat similar cell to the original one. So we can describe this one as normal growth. This can be well-differentiated cells or a well-differentiated tumor. This can be poor to undifferentiated cells. Okay, I hope you get the idea of differentiation. And the differentiation is judged by microscopic examination of cells, right? So based on the terms or the definitions that we described, we classify the tumors according to their behavior into benign tumors with good outcome or good prognosis, okay, and malignant tumors with bad outcome and bad prognosis and bad criteria. And in between, there is locally malignant or locally aggressive tumors, which have many criteria of the malignant tumors, but not all of them. So they are intermediate in their malignancy behavior. And also we have another classification of tumors based on the tissue of origin, either from epithelial cells or from mesenchymal tissue. Okay, and by mesenchymal tissue, we mean supporting tissue in the body, like muscle, fat, bone, cartilage, fibers tissue, and so on. And by epithelium, we mean the cells that line or cover the body, and the cells that are the organs, and the cells that secrete hormones or secretions or protein or whatever. So benign tumors are tumors with good behavior. Malignant tumors are tumors of the bad behavior. Let's compare benign and malignant tumors. Benign tumors are slowly growing. Both benign and malignant tumors have uncontrolled cell proliferation, right? But benign tumors have slow rate of growth. In other words, the patient tells you that he had a mass that started 3 or 4 years ago, and it just in 4 years get bigger by 1 centimeter, for example. So this is a slow rate of growth. While malignant tumors are rapidly proliferating tumors. So in 1 month, you get, for example, 5 centimeters, right? Benign tumors grow by expansion, so they compress the surrounding tissue. They don't kill the cells around them. No invasion in the benign tumor. While in malignant tumors, they grow by infiltration of the surrounding cells. They kill the surrounding cells and invade them and replace them and occupy their place. Okay? Benign tumors are more well-defined, okay, have well-defined borders. While malignant tumors, because they are invading the surrounding tissue, they don't have well-defined borders. Okay, benign, they have irregular borders. Benign tumors grossly, and by gross picture, gross, G-R-O-S-S, it means the description by the naked eye, the description of the lesion or the disease by the naked eye. The benign tumors, if on the surface, they may form papillary projections, or this it's called polypoid projections or finger-like projections if in the surface, or they give us well-defined solid or cystic mass if in a solid organ or internal organ. Okay. However, the malignant tumor has a characteristic description in which the malignant tumor appear as a cauliflower-like mass, or called fungating, or an infiltrating, deeply infiltrating mass that thickens the tissue, or a malignant ulcer, okay, which has edges that look outside externally. It's called everted edges, and they have necrosis and hemorrhage in the floor. Let's see the pictures and try to understand. And so let's try to guess based on the description we just described. Here, there is a finger-like projection, right? Of a well-defined mass. Do you think these tumors are benign tumors or malignant ones? Benign. These are called papillary or polypoid projections. So let's see the next picture. This is a tumor with a well-defined border, right? Not an invasive one. Do you think this is a benign or a malignant tumor? Yes, this is a benign tumor with well-defined. It may be solid or cystic. Cystic means internally filled with fluid. Solid means it is internally solid. Okay, so we cannot judge from outside. We may judge when we grab that tumor and feel the content. But we have a well-defined tumor. Most probably it will be a benign. By the way, we cannot just swear that this tumor is a benign or a malignant, except after taking a biopsy and examining it under a microscope. But we can suggest the behavior. So let's see this one. This tumor looks ugly, right? It has areas, red areas of bleeding. It has hemorrhage inside it. And it has yellowish areas, which demonstrates necrosis, right? And it has an irregular shape, right? It is not that well defined, right? It has irregular border, right? It resembles the cauliflower mass. This is a malignant tumor. It's called cauliflower or fungating in shape. So let's see this one. This is a tumor that forms an ulcer. The ulcer has a central depression, right? And this ulcer is raised, it is above the level of the lips. Do you see? Okay, so it is raised above the surface. This is the whole ulcer. It has an edge and it has a floor, which we do see, okay? And it has a base. The base, we don't see the base, but we can feel it when we grasp it. So the edges are looking outwards, right? It looks outward. It's like when I take a cut section to see the side view of this ulcer, okay? So if I do that, I'm sorry. Yeah, it is cut section. I will see what? I will see, this is the level of the skin, okay? And then I will see a raised ulcer, okay, raised edges at above the surface. This is the surface of the skin, this one and this one. And where is the tumor? This one, okay? So the edge is elevated above the surface and looking outwards, looking externally. Why? Because the tumor is rapidly proliferating. It is forming extensions, outward extensions, because it is invading the outward nearby tissue, okay? So this is the description of the malignant ulcer. The center of the ulcer is called the floor, which is depressed, okay? And in the floor, we see light yellow areas, which are necrosed tissue, and reddish areas, which represent hemorrhage inside the tumor. And I will explain later on in this lecture why malignant tumors have hemorrhage and necrosis. So this is most probably a malignant ulcer. It is a malignant tumor. Let's see this one. We have a mass. This is the organ, and we have a mass here, but the mass neither fungating nor forming an ulcer. It is causing some thickening of the tissue, right? And this mass has irregular borders, which I'm drawing now, right? Invasive borders. So this is called an infiltrating mass. It is a malignant tumor with invasive border, right? So now we know the most probable shapes of the malignant tumors versus the benign tumors. Okay, let's see here. This mass has a well-defined border, right? It is most probably a benign tumor, no invasion. That's why it is well-defined, right? While here, there is invasive border. What is meant by invasion? Invasion means it grows on that nearby closed tissue, right? It kills the nearby tissue and replaces it. Okay, so this is an invasive border. That's why it is irregular. Okay, so it is a malignant tumor. Let's continue the comparison. So benign tumors are usually well defined. Sometimes they have capsules. The capsule is like a fence that localizes the tumor. So it is a good thing, right? While malignant tumors don't have capsules because they have invasive borders. They don't have boundaries. Nothing can limit them. Benign tumors have less ulceration, less hemorrhage, and less necrosis, while malignant tumors have marked ulceration, hemorrhage, and necrosis. Let's see the hemorrhage and necrosis, then explain why. This is a brain, and this is a tumor. In this tumor, we see reddish areas right here and here. This is hemorrhage inside the tumor mass. And we see lighter yellow areas that are lighter than the tumor proper, right? This is dead tumor cells, this is dead tumor tissue. This is called necrosis. Necrosis means dead tissue, okay? So why malignant tumors get hemorrhage and necrosis? Because the malignant tumor is very rapidly proliferating, right, compared to the benign ones. The rapid rate of proliferation of cells exceed the blood supply that comes to the tumor. So cells grow without nutrition, so they die. This is necrosis. So now we know why malignant tumors have a lot of necrosis. Another thing, why hemorrhage? Because the tumor tries to increase the blood supply, the deficient blood supply, by forming new vessels. However, these vessels are not well formed. They are forming rapidly. They have weak walls, so they can rupture easily inside the malignant tumors and form the red hemorrhage. Okay? And this brings us to the concept or the term of angiogenesis. Angio means vessel. Genesis means creation. So angiogenesis is the process of creating new blood vessels. There is also another term with the same meaning. It's called neovascularization. Neo means new. Vascularization means vessels. So new vessels. Angiogenesis and new vascularization forms more in these processes are more in malignant tumors than benign tumors. And let's see a video demonstrating angiogenesis. Yeah. These are the vessels that supply the tumor, right? Let's have a closer look. What is that? New vessel formation, right? Yeah, new vessels are formed rapidly, but they are weak vessels. Okay, this is called angiogenesis. These are the vessels that will rupture and cause hemorrhage inside that tumor. I hope you got the idea of angiogenesis, and you now know that angiogenesis is more prominent in malignant tumors. So let's continue our comparison between benign and malignant tumors. Till now, we know that benign tumors are better. They have better criteria. They are well defined. They are usually capsulated. They grow by compression, while malignant tumors have worse criteria, like they are ill-defined. They have irregular borders. They grow by invasion, right? And we know that grossly benign tumors are well defined, and they may be polypoid or finger-like in shape if they are growing on the surface of the body or an organ, while malignant tumors have ugly shapes like fungating mass, cauliflower-like mass, malignant ulcer with raised everted edges, and or infiltrating mass with thickening of the tissue. We also know that benign tumors have less hemorrhage, necrosis, and ulceration, while malignant tumors have marked hemorrhage, necrosis, and ulceration. And we know that the process of angiogenesis with new blood vessel formation occurs more in the malignant tumors, right? That's why we get more hemorrhage in malignant tumors. Under the microscope, cells of benign tumors are well differentiated, which means they are very similar to the original cells, while cells of the malignant tumors may be anything, may be well differentiated, moderately differentiated, poorly differentiated, or undifferentiated at all. Benign tumors have no ugly cells. It means they have no microscopic features of malignancy in the cells, while malignant tumors have microscopic features of malignancy. So what are the microscopic features of malignancy that are present in malignant tumors? Let's remember this picture in which cells the daughter cells that resemble the original cells are called well differentiated. Sometimes malignant tumors have more ugly cells. Malignant tumors have a high rate of cell proliferation and division, right? Normally in the normal graph, one somatic body cell divides by mitosis into two similar cells of same shape of the nucleus and the cytoplasm. Okay? But in malignant tumors, one cell may give rise to 10 cells, 50 cells. So the rate of proliferation is very high. So if I told you that cells, before they divide, they duplicate their DNA content first. So I think you will predict or expect malignant cells to have multiple duplications of the DNA content in the nucleus before dividing and giving rise to many daughter cells. So this duplication of the DNA content in the nucleus will make the nucleus larger in size. That's why we see nuclei of malignant tumors have large size in relation to the cytoplasm. In comparison to, in comparison to the size of the normal nuclei of the original cells. Okay, this is called increased nuclear cytoplasmic ratio. Let's see in details in the next slide. Okay, another thing, because cells have more DNA content, because they are going to divide into larger number of cells compared to normal, so I expect the staining of the nucleus, which is usually blue, to be darker blue compared to original nuclei or not? Yeah, I expect to be darker blue. This is called increased staining or hyperchromatism. Another thing, cells of malignant tumors do not obey the normal growth laws, right? So when cells divide, they divide rapidly. They do not give so much concern to be all of the same shape, right? So this is called cellular pleomorphism. Pleo means poly, multiple. Morph means morphology. Cellular means cells. So cells are of various shapes in malignant tumors, while in benign tumors they are all the same. Okay, this is called one of the features of malignancy. Okay, cells have different shapes: oval cells, rounded cells, tubercle cells, bizarre cells. Okay, giant cells. Okay, and also the nuclei are not similar. So I may have oval nuclei, irregular nuclei, right? This is called nuclear pleomorphism. And the increased nuclear size, it is called increased, N is for nuclear cytoplasmic ratio, when the nuclei are large in size compared to normal nuclei. And also the darkly stained nuclei, it is called hyper, means increased, chromatism means chromatic means staining. It is increased staining of the nuclei. Also, we may get cells with vesicular nuclei. Vesicular nuclei are lighter in shape with prominent central nucleolus. This shape of the vesicular nuclei denotes active cells. So we may have cells with darkly stained nuclei or cells with lightly stained nuclei and prominent nucleus. Both may point to malignant cells. And also we may have multinucleation. We may have cells with multiple nuclei. And we will see different shapes of mitosis. It's called mitotic figures. Because mitosis means our cells are in stages of proliferation and division, right? So these criteria, these microscopic findings reflect malignant criteria of cells. Okay? Let's see the mitosis in detail. Mitosis is formed of stages. There is a stage called prophase. It is the initial stage. Pro means primary, preparatory phase. And the nucleus is like in normal resting cells under the microscope. Then we have the metaphase. And in the metaphase, the chromatin just arranged in the equatorial, in the midline of the cell. Okay? And we, under the microscope, see the cell like that, with chromatin is like a stick in the center of the cell. Then there is the anaphase, in which the chromatin separates. It separates because it will give two cells. It's called anaphase. And then the telophase, or the final phase, in which the cells separate. The original cell separates into two cells, two daughter cells. These stages can be seen under the microscope by microscopic examination. However, in normal tissue, these phases are seen in fewer numbers because the rate of growth is slow. In benign tumors, we can see stages of normal mitosis, but in few numbers because the rate of growth is slow. But in malignant tumors, we see high rate of mitotic figures. We can get many metaphases, many anaphases, many telophases, because frequent presence of mitosis reflects high growth rate. So in malignant tumors, we see under the microscope many mitotic figures. Okay? Moreover, in malignant tumors, because they don't obey the laws of proliferation, we can see phases of abnormal mitosis that cannot be seen under normal conditions. Like we can see the nucleus, the chromatin of the nucleus organized in a Mercedes-like figure, and it is called Mercedes mitosis, or in a sun ray or star appearance. It is called sun ray or star mitosis. These are abnormal mitotic figures, or in a ring shape, okay? And these forms will be seen in malignant tumors, not in benign ones, okay? So let's apply on this picture. This picture contains many cells. I will not ask you to define the tissue or something. I just want you to understand the idea of malignant features under the microscope. So let's focus here on this one. What is that? These are two cells that are preparing to separate, right? It is a mitosis. It is the last stage of mitosis, right? Which is what? Let's see here. The telophase, right? Okay? So here is a normal mitosis, mitotic figure. And what is that? Maybe anaphase, chromatin is trying to separate, right? This is normal mitosis. So we have two mitotic figures here, right? Let's see here. We have a cell with large sized nucleus, which means increased nuclear cytoplasmic ratio. But the nucleus, which is blue in color, is light with central nucleolus. This is called vesicular nucleus. Okay, it resembles the eye with the pupil here. Vesicular nuclei reflects high rate of proliferation, reflects active cells. Okay, there is another one, but not so prominent here. And here, this is a nucleus with nucleolus, vesicular. And this one, and this one. All of these are vesicular nuclei. Let's see this nucleus. It is very large, right? High nuclear cytoplasmic ratio. And this nucleus is not similar in shape to this one, or this one, or this one, or this one, right? We have different morphologies of the nuclei. This is called Pleiomorphism or polymorphism. Similarly, cells are not the same. This cell is not similar to this one, is not similar to this one, which is somewhat pyramidal. This one is somewhat columnar, right? This one is somewhat pyramidal. This one is somewhat rounded, right? So we have different shapes of cells. This is called cellular polymorphism or cellular pleomorphism. And by the way, here is a star-shaped mitosis, if you notice. Okay, so I have abnormal mitosis here. I have high rate of normal mitosis. I have vesicular nuclei, right? I have pleomorphism or polymorphism. I have hyperchromatism. Sorry, do you see this chromatin here? This dark stained large nuclei. I have increased nuclear cytoplasmic ratio. All these features makes me think of malignant tumor. These are called malignant features and the microscopic features of malignancy. Let's see this one. Very ugly cells, but let's focus here. What is that? This cell has a Mercedes-like chromatin. This is abnormal mitosis. And this is a sun ray appearance or a star-shaped mitosis. It is abnormal mitosis. And this is another one, star-shaped mitosis, abnormal mitosis. And we have giant cells here, large cells with multiple nuclei, and bizarre cells, right? This is a feature of malignancy. And when we look in the nuclei, we see some very darkly stained large nuclei, right? So we have hyperchromatism. You can compare this nucleus color to this one. This is very dark. It's called hyperchromatism. And the size of the nucleus is very large. This is called increased nuclear cytoplasmic ratio. Compare the size of this nucleus to this one. This is very large, right? Because it is a cancer. And nuclei vary in shape. This one is not like this one, is not like this one, is not like these ones, right? They vary in shape. This is called nuclear pleomorphism. Okay? And these are features of malignancy under the microscope. Another thing, so we now know that there are morphologic changes of cells that denote malignancy, right? And we have architectural changes. It means abnormal organization of cells. Normal cells have something called polarity. What is meant by polarity? Polarity means that cells respect each other. They respect the order or respect the organization of each other. For example, we may have a tissue that normally have columnar cells. Then above the columnar cells, there are rounded cells. So the poles or the ends of cells respect the order of each other. However, in malignant tumors, there is loss of polarity, means cells do not respect each other. They arrange in a haphazard manner. They arrange without organization. So we don't see the normal order of cells. This is called loss of polarity or architectural change of cells. And this is seen also in malignant behavior. So this is normal polarity, this is loss of polarity. So now we know that mitosis numbers in benign tumors under the microscope is less than in malignant tumors. And we know that benign tumors under the microscope have less vascularity than malignant tumors that form angiogenesis and have malformed blood vessels. Also, under the microscope, benign tumors have near normal cells in a large number, no background reaction between the cells, no tissue reaction. While in malignant tumors, there is a tissue reaction between the malignant cells. This reaction is formed of inflammatory cells and stromal cell proliferation. So the stroma proliferate and deposit collagen, dense fibrous tissue between the malignant cells. These inflammatory cells, this inflammatory and the stromal proliferation or the fibrosis are called combined desmoplasia. So desmoplasia is the background tissue reaction in the tumor. And dysmoplasia is mostly present in malignant cells. Dysmoplasia is a feature seen under the microscope because it is formed of cells and fibers. Dysmoplasia is the cause that malignant tumors are hard on touching, okay, hard in consistency, while benign tumors do not have this dysmoplasia. Okay, so this is a microscopic picture. Regarding the behavior, benign tumors have better prognosis, better outcome, and they do not metastasize, they do not send distant cells to implant in other organs. While malignant tumors can metastasize, can form metastases like the video we watched together, and they send malignant cells that implant in other tissues. Benign tumors, if removed surgically well, they don't recur. While malignant tumors, because they grow by invasion, they may have hidden cells inside the tissue. So even after surgical removal, they may recur. Benign tumors mostly non-fatal. They are not deadly, except in some certain conditions that we will mention later on in this lecture. While malignant tumors, because they form destruction of tissues and spread, may be fatal. So, till now, we divided the tumors into benign and malignant. However, we have a third type according to the behavior, which is called locally malignant or locally aggressive tumor. This tumor under the microscope has similar features of malignancy, which are increased nuclear cytoplasmic ratio, hyperchromatism, Pleiomorphism, mitosis normal and abnormal, right? Vehicular nuclei. And it grows by invasion of the surrounding tissue, and it is ill-defined. It's like malignant tumors. However, they do not send distant metastasis. They don't form distant spread away from the original tumor. They only invade the surrounding tissue. Okay? And the rate of growth is slower than malignant tumors. However, they are more rapid in rate of growth than benign tumors. Okay? And there is an example here we will discuss in a later lecture in details, which arises from bone. It is called giant cell tumor of bone. So, however, we still didn't discuss bone tumors, but when I tell you there is a giant cell tumor of bone that is locally malignant or locally aggressive, you can tell me that this tumor will grow by invasion of the surrounding bone and muscles, right? And it has microscopic criteria of malignancy, and it is of intermediate rate of growth, and does not, most probably does not send distant metastasis. Okay? So, to diagnose a malignant tumor under the microscope, we need to see changes in cell morphology, we need to see changes in cellular architecture, and we need to see invasion of the surrounding tissue. If there is a distant spread, or the tumor is the malignant tumor is capable of forming this sending distant spread, it is called a malignant tumor, malignant in behavior. While if the tumor cannot send distant spread, in most cases it is called locally malignant or locally aggressive. So, what are the complications of benign and malignant tumors? Benign tumors have good outcome, right? However, they may sometimes cause serious complications. These complications are related to the site where the tumors arise. For example, if a benign tumor arises in the larynx, in the respiratory tract, they will obstruct the airway, right? They will interfere with gas entry, with air entry, right? They, in this condition, they are serious. If a benign tumor arises in the brain, although it is benign, but it will compress the brain tissue, right? and it will affect the function of the brain because there is no space in the brain for the tumor to grow. So although the tumor grows with a slow rate, it is a benign tumor, and with just compression, no invasion. However, it can have serious effect because it is compressing nerve cells. Also, benign tumors may turn into malignant tumors, but in different rates. In other words, benign tumors have various types, okay, subtypes. And each type has a different probability of turning into a malignant tumor with time. Some types do not turn malignant at all. Some types have very low percentage or probability of turning into malignant tumors. But some types have a high rate or high probability of turning into malignant tumors. And this affects the decision of the surgeon, who may ask the patient to undergo surgery, an immediate surgery to remove a benign tumor, or in another type of benign tumor, the surgeon may tell the patient, you can wait. No serious problem of that tumor will happen. Okay? So it may turn into malignant. Some tumors, benign, although they are benign, may be functioning. What's meant by functioning? Secretes hormones, secretes protein. And this secretion is abnormal and will lead to metabolic changes in the body. For example, maybe a benign tumor that secretes a hormone that takes calcium of the bone. This tumor, although it is benign, it will affect the bone structure and bone strength, right? This is called functioning, and this will cause complications. The last complication that of benign tumors, that maybe the tumor just making cosmetic deformity if it is external. Like someone has a benign tumor in the face or in the hand or in the neck. The patient may complain that he is unsatisfied about his shape or about his figure. And although the tumor has no other complications, he asks the surgeon to remove it. This is called cosmetic deformity. Okay? So these are the possible complications of benign tumors. However, in malignant tumors or cancer, there are more serious complications that may lead, in some cases, to death. Like what? Like organ destruction. Because malignant cells invade the tissue and kill the cells and replace them, there is destruction of the original tissue, right? And also, as malignant cells metastasize and spread to distant organs, they also destruct the distant organs, right? So there is organ failure, which may be cause of death in some cases. Also, malignant tumors can arise in areas that, even if they are in small size, can have great symptoms or great complications, like in the CNS or in the respiratory tract, right? Because when they arise in CNS, they will compress central nervous system, like the brain or spinal cord. They will compress and they will invade the brain cells, right? And this may cause paralysis, weakness, in loss of sensation, loss of ability to talk, loss of memory, and so on. Also, because the brain is in a tight box, which is the skull in the head, even small size tumors can lead to high pressure inside the skull, which is called increased intracranial tension, which causes further compression of the brain and further neurological symptoms. Moreover, malignant tumors causes a wasting syndrome. What is meant by wasting? Wasting means the body mass is wasted, it is lost. The body in a state of catabolism. There is destruction of the body fat and protein, muscle, and also there is weakness, there is anemia, there is loss of the hunger sensation. This is called anorexia. Okay, so maybe a patient with malignant tumor, the patient does not know he has a tumor, but he present to the doctor with one thing: I have lost a massive weight in a very short duration. This may make us think there is a hidden malignancy here. This wasting syndrome has a description. It is called cachexia. Also, tumors interfere with digestion and absorption of food, especially if they arise in the gastrointestinal tract, which is, I think, pretty reasonable, right? So they cause malnutrition, which may aggravate the cachexia, right? And the weakness and the loss of power inside the body. Moreover, as we know that malignant tumors can have hemorrhage because they form new vessels that have weak walls, right? So hemorrhage means loss of red blood cells from the circulation. So this may lead to anemia, which leads to more weakness of the cancer patient. Other than this, the tumor mass itself can be infected with bacteria, with parasites, with opportunistic infections that usually do not infect people with normal immunity. Also, while the patient is being treated with chemotherapy, for example, sometimes the treatment regimens contain immunosuppressive drugs. So in this case, the patient may be subjected to higher rate of infection or a higher possibility of infection, and infection by organisms that usually do not infect people with normal immunity level. These are called opportunistic infection. Opportunistic means organisms that normally cannot infect us, but in conditions with low immunity, they take the advantage of this condition and become opportunistic infection. And sometimes these opportunistic infections are resistant to treatment and become fatal. Okay, so till now, we know some definitions about tumors like neoplasia, like invasion, like metastasis, like differentiation, right? After that, we classified, like angiogenesis also. After that, we classified the tumors according to behavior into benign tumors, malignant tumors, locally malignant or locally aggressive tumors, right? And then we compared benign and malignant tumors. And also, we discussed the complications of benign and malignant tumors, and what are the serious complications of benign tumors, although it is benign, and what are the causes of death in malignant tumors. Okay. Also, we mentioned that there is another classification. Some scientists classify tumors according to the tissue of origin, because some tumors arise from the epithelium. Epithelium is the cells that line or cover the body organs, like the skin, okay, like the lining of the gastrointestinal tract. This is lining or covering epithelium. Like the epithelium that is present in the glands, it is called secretory epithelium, okay? So they found that tumors that arise from epithelium have certain characters. That's why they classified them according to the tissue of origin. And there are some tumors that arise from the mesenchymal tissue or mesenchymal origin. What is mesenchyme? The supporting tissue like fibrous tissue, fat, vascular tissue, nervous tissue, fibrous tissue, muscles, bone, cartilage, okay? These are the tumors that arise from mesenchymal tissue also have similar criteria. That's why some scientists group them together in the classification. And we will discuss this in more details next lecture, if God will. So the last part of our lecture. How do we name the tumors? Nomenclature of tumors. In order to name tumors, we put in the tumor name, in the final section of the tumor name, the OMA. OMA means mass or swelling in Latin, okay? Then we add in the initial description of the name, the tissue of origin, or maybe the shape of the tumor. Let's clarify more. Here in this table, let's look in the connective or mesenchymal tissue. We have bone as a type of mesenchymal tissue, right? Bone in Latin is called osseous tissue. So when a benign tumor, a tumor arises from osseous tissue or bone, it is called osteoma. Oma means swelling or mass. Osteo means bone. So osteoma is the mass that arises from the bone. It is a benign tumor. Let's take another example, cartilaginous tissue. Cartilage in Latin is called chondro. So chondroma means oma, swelling or mass of the chondro, made of the cartilage, okay? It is a benign tumor. Muscular tissue in Latin is called myo. So if a benign tumor arises from muscular tissue, it's called myoma, okay? But muscular tissues, muscles have different types, like smooth muscles, which are involuntary, non-striated muscles, and skeletal muscles, which are voluntary and striated. So smooth in Latin is lyo. So a benign tumor arising from smooth muscles is called leiomyoma. Leo, smooth, myo, muscle, oma, mass of smooth muscles. So leiomyoma, a benign tumor arising from smooth muscles. But what about skeletal muscles? Rhabdo in Latin is it means striated muscle. Myo, muscle, oma, swelling. So rhabdomyoma is the swelling or mass of the muscle that is striated, which is a skeletal muscle. Okay. The blood vessels, vascular tissue. Blood is also called in Latin heme. Heme means blood. Vessel is called angio. Do you remember angiogenesis? Angio means vessel. Hemangioma. Oma is the mass that arises from the vessels of the blood. Okay? So the lymph vessels, lymphangioma. Mass that arises from angio, the vessels of the lymph. Okay? Fibrous tissue. Fibroma, mass of fibrous tissue. Fat tissue or adipose tissue. It's lipid. It's from lipid, derived from lipid. Lipoma, mass of fatty tissue. These are all benign tumors arising from mesenchymal tissue. That's how we name them, okay? From the Latin word of the tissue and adding oma, okay? What about the epithelial benign tumors? The epithelial benign tumors also have oma at the end of the word, but they are described differently. Do you remember the picture of the benign tumor that arises in finger-like projection around the eye, right? We described it as benign earlier in our lecture. It had finger-like projections around the eye, okay? And we described this as having polypoid or papillae, right? So when a benign tumor arises from surface epithelium and have papillary appearance, they name it after its shape. So it is called papilloma. So papilloma is the benign tumor, oma mass that have papillary structure. And we have papillary structure when the benign tumor arises from surface epithelium. However, if the tumor a benign tumor arises from secretory or glandular epithelium, it is called adeno, in Latin means gland. So it is called adenoma. So this is the tumor that arises from adenome, from the gland. Okay, I hope you got how do we name benign tumors. So let's go to the malignant nomination. Malignant tumors that arise from epithelium have the word carcinoma. Malignant tumors that arise from mesenchymal or connective tissue are called sarcoma. Okay? So when a malignant tumor arises from a surface epithelium, it is named after the type of the epithelium. For example, from the transitional epithelium, it is called transitional cell carcinoma or squamous cell carcinoma. Okay? But if the malignant tumor arises from the glands in Latin mean adeno, it is called adenocarcinoma. Carcinoma means malignant tumor from epithelium. But what about the connective mesenchymal tissue? In mesenchymal tissue, we just put at the beginning of the word the Latin derivative of the tissue, okay? And add the word sarcoma. For example, the fibrous tissue is called fibrosarcoma. Sarcoma, it is a malignant tumor that arises from mesenchymal types of tissue. And fibro is the fibrous tissue. So it is the type of the mesenchymal tissue, okay? Fibrosarcoma. Fat, liposarcoma. Bone, osteosarcoma. Malignant tumor arising from mesenchyme, which is bone. Cartilage, chondrosarcoma. Malignant tumor that arises from mesenchymal tissue, that is cartilage. Muscle, smooth muscles. Myosarcoma. Skeletal muscles. Rhabdomyosarcoma. Blood vessels. Hemangiosarcoma. Lymphatic vessels, lymphangiosarcoma, and so on. Okay, we will return again to the nomenclature in more details and description in the lecture number 3 in this module. Okay, continuing the nomenclature. The previous terms or the previous names were given to tumors that arise from mature body cells. Okay, however, sometimes tumors may arise from baby cells. Okay, when we form as embryos inside the uterus of our mother's body, at first we are formed of few cells. These cells have the potential to divide into any type of tissue. That's why, although we are formed at first, initially from few cells, we have many types of organs and tissues in our mature body, right? So these cells are called totipotent cells. Toti means total, potent means potential. So the cells have total potential. Total potential for what? For dividing into any type of tissue. So imagine that there is a tumor that arises from totipotent cells. This tumor will make a cell proliferation. But these totipotent cells, when divided, they differentiate to tissues. So in this case, the totipotent cell tumor will have different types of tissue. Like we may have a tumor that have skin and pancreas and brain tissue and cartilage or bone, all in a single mass. Okay, so we call this one teratoma. Oma means mass, terato because it is derived from totipotent cell. Okay, teratoma may be benign or malignant, by the way, so we cannot classify it as a benign or a malignant. Sometimes it behaves in a benign fashion, sometimes it behaves in a malignant fashion. So teratoma is a tumor that arises from totipotent cells, TT, okay, to remember. Okay, the cells that have the ability to differentiate along any cell line, ectoderm, endoderm, or mesoderm. So these tumors can have any component from any tissue in the tumor itself. Okay, there is on the level of the organ, after the totipotent cells differentiated into different tissues or organs in normal embryology, each organ at first is formed of primitive or primary baby cells, right? It's called primitive cells. Sometimes these primitive cells, one of the primitive cells actually go mad and proliferate uncontrollably and form a tumor. In this case, we name this tumor blastoma. Blast means primitive cell. So blastoma is the mass or the tumor that is formed of blast cells, of the primitive cells. And we name the blastoma after the organ in which it arises in. So if a tumor arising from primitive cells of the liver in Latin is called hepato. So we say hepatoblastoma. If a tumor arising from primitive cells of the kidney, it is kidney, it means nephro in Latin. So we name it nephroblastoma. Again, blastomas cannot be classified as benign or malignant, although they may differ in behavior, although most blastomas are malignant, by the way. Okay? So this is to complete the picture of nomination of tumors. For now, we have finished our lecture. We let's just regain it. We defined some terms like neoplasia, new tumor growth, neoplasm, it's called the tumor. Invasion is replacing the nearby tissue by tumor cells. Metastasis is the distant spread of tumor. Angiogenesis is the new formation of vessels. Differentiation is the extent to which the daughter cells resemble the original tissue. And we classify the tumor according to behavior into benign, which have better prognosis, malignant, which have worse prognosis, and locally malignant, which is in between. And we classified the tumor according to the tissue of origin into epithelial and mesenchymal. And we outlined the classification, the nomenclature of the tumors, in which benign tumors have the word oma in the final part of the tumor, while the malignant tumors have the word carcinoma if the tumor arises from the epithelium, or sarcoma if the tumor arises from mesenchymal type of tissue. And also we have blastoma and teratoma, in which blastoma arises from primitive cells of the organ and mostly are malignant, although some blastomas are not malignant, but the most are malignant. And there is the final type, which is teratoma, which arises from totipotent cells and give multiple types of tissues inside the same tumor, and they may behave as benign or malignant. And we know that complications and causes of death for tumors can differ from malignant to benign, with most causes of death in malignant tumors. However, sometimes benign tumors can be serious if they arise in a critical site, like in the brain or in the airway. And we now know that benign tumors may turn into malignant sometimes. Okay? And the possibility of turning into malignant differ from one type of tumor to another type. And we know that malignant tumors can cause cachexia, and cachexia is a wasting syndrome of the body and may be the first presenting symptom of the patient. So by this summary, we finish our lecture, but I want you to train yourself, and I will help you with that, to train yourself on analyzing cases and solving them, because actually when you graduate, you will deal with patients, which are cases, right? You will deal with a large amount of data that the patient gives you or you find by examination, and you need to analyze them to get a diagnosis, right? So it is a skill, It is a thinking skill, and it can be developed by continuous training. So let's try to learn by case-based learning and analyze this case. A 25-year-old patient presented to the surgery clinic by a painless thigh mass. The patient gave a history of slow rate of growth over 2 years duration. So this mass started 2 years ago and it has a slow rate of growth. This makes us think that this mass is something benign or malignant. I think something benign because it has slow rate of growth, right? We will see. Let's continue. The mass is disturbing him cosmetically. Okay, it means there are no other symptoms. On examination, the mass was subcutaneous. It was under the skin. That's what is meant by subcutaneous. Well defined, soft, and mobile. Well-defined mass makes me think more of benign or malignant tumor or locally malignant of benign, right? And it is soft, not hard. So I think there will be no dysplasia, no fibrosis inside the tumor. So this also makes me think it is benign. No enlarged draining lymph nodes were detected. So it may be no, in other words, no spread to lymph nodes, right? All this data makes me think it is a benign tumor, right? Imaging of the mass by ultrasonography showed a mostly benign tumor, okay? So the imaging suggested it is a benign tumor. The mass was excised because the patient is disturbed by the cosmetic appearance of the mass, right? And sent to a pathology lab. And always know that any excised tissue from the body must be sent for pathological examination to rule out malignancy, to exclude there is a malignancy, hidden malignancy here. Okay? So the mass was excised and sent to the pathology lab. What is the possible microscopic findings that will be detected? We now think it is a benign tumor, right? What are the possible microscopic findings that we will find in this benign tumor? Choose. Number one, capsule around the mass. Possible, right? Because benign tumors may have a capsule, may have, right? The second choice is invasion of surrounding muscle and bone by the mast cells. No, invasion of surrounding muscle. Benign tumors do not grow by invasion. They grow by compression. Malignant tumors grow by invasion, right? So it is not B. C, cells with hyperchromatic large nuclei and high rate of mitosis. Can we find that in benign tumors? I think no. Cells of benign tumors under the microscope have no criteria of malignancy and have low rate of mitosis because they are slowly proliferating, while malignant tumors and locally malignant tumors have this description, the hyperchromatic large nuclei and high rate of mitosis. Number D, poor differentiation of cells, which means cells are not similar to the original tissue. Do we find poor differentiation of cells in benign tumors? No, we find them in malignant tumors. So the answer for this case was capsule around the mass. I hope you got the answer right while you are listening to the lecture. By the way, because I aim to make you develop your thinking skills and application, I will soon send a link for a game-based application. Okay, the game will contain questions that you will try to answer based on your understanding, and after each question you will get your answer right or wrong, and you will know what was the right answer. Okay, it is to assess yourselves and to assess your understanding. So be prepared, okay, to get the link in 2 days, in the next 2 days, and please participate. I will count your participation, not your score. Okay, I am interested in making you participate and train yourself. I'm not putting you to a test now and give you a score. Okay, so try yourself, please. The application is called Kahoot application. You don't need to download it. You just press on the link and sign up with your name and try yourself. Also, I will send you the first assignment soon. And the assignment will be a case or a lesion of the week. And I think mostly it will be every week. And also the case will have questions. And I need you to answer the questions. Okay? I am not testing you. I want you to try yourself. The assignment contributes to your module scores, okay? But I will not count your score based on your answers, right or wrong. I will count your score based on, did you participate in this assignment or not? So please try yourself. And after each question, the assignment, you will get a feedback with the right answer and explanation for the question. So I'm just making you improving your learning, okay? And here is my teaching goals and why I'm doing that, why I'm sending you many cases and why I'm wanting you to train, because I want to elevate your level of learning from the lowest level, which is remembering the information, into understanding and ability to explain the information. And also I want to raise your level to application of information on cases, right? Like the case-based learning, okay, and the practical labs. And also I want you to analyze the cases in case-based learning and the assignments and the Kahoot game that I will send you the link. And also I want you to reach a higher level of learning, which is evaluation of information. When I give you a piece of information, you judge it, is it right or wrong? Okay, so in learning, this pyramid, by the way, is designed by one of the medical education experts in the field. Okay, the higher the level of thinking we reach together, the better your learning is. So please help me to make you study better, okay, and try to fulfill all the requirements, okay? The lecture notes is enough for studying, but if you want to read from the textbook is will be present on the resources file on the EKB, and the part that we already explained in this lecture is from page 187 to 194. Okay, thank you. Meet you soon. Goodbye.